Okay, good morning. Ohayo gozaimasu. First of all, I'd like to thank for the organizing committee for arranging this seminar. I really appreciate it. And then I really love to share my research in Malaysia. And then I also like to thanks to the moderator for the kind introduction. I would say shall we start now? Okay, my research, my topic for today is on pesticide exposure and adverse health effect in Malaysian farmer. So I will start my presentation with a little bit of introduction about the agriculture system in Malaysia and about the studies on the pesticide exposure and acute health effect in the developing countries. First of all, I want to introduce where is Malaysia. I know that I'm not sure, but I believe that everyone knows where is Malaysia. So this is Japan, and this is Malaysia. It's about 6,000 miles away from Malaysia. And then if I can ask on-site participant, how many of you has been to Malaysia? I realize that some of you mentioned just now. Okay, I would say that around half of the participant. So I give a brief introductions about Malaysia. Malaysia is one of the countries in Southeast Asia, and then in terms of total areas, more or less the same with Japan. For Malaysia, the total areas is about 330,000 square meter, whereas Japan is about 370,000 square meter, is more or less the same. However, in terms of population, Japan has 4-fold higher population compared to Malaysia, where in Malaysia we only have like 33 million population, where in Japan you have like 137 million population, so 4-fold higher than Malaysia, even though the total area more or less the same. As you can see from this photo, Malaysia can be divided into 2 sections. On your left is a Peninsula Malaysia, it's a main island, or we call it as a West Malaysia. And then on your right side is the East Malaysia, or we call it Borneo Island. I'm originally from Kelantan area here. It's near the border to Thailand. However, currently I'm working at Kota Kinabalu, Sabah in the Borneo Island. It's quite far away. However, I enjoy my stay in Kota Kinabalu. A peninsula consists about 40% of total island, total Malaysia, and the remaining 6% are from the Borneo side. However, majority of the activities are concentrated in Peninsula Malaysia, and Kuala Lumpur is our capital city. That's all about it. Okay, now I'd like to introduce about agriculture in Malaysia. I would say is of course different compared to what you have in Japan. In Malaysia, service sector is the main contributor to the economy of Malaysia. For Malaysia, followed by manufacturing, mining sector, and then the top 4 is agriculture. And the agriculture we can consider as a backbone of the economy of the Malaysia. If we look at this Malaysian GDP, like I mentioned, agriculture contribute to the 4th of the Malaysian GDP for about 10.9% of total Malaysia GDP. And then among agriculture sector, oil plant sector is the main contributor among agriculture, followed by other agriculture sector, for example, vegetable, fruit farming, and also rice farming. And then in Malaysia, nearly 11% of the total population engaged with agriculture work, especially those are living in the rural area, and is a man dominant. When we talk about the health effect of pesticide on human health, as we all know, the health effect you can divide it into acute and chronic health effect, and then pesticide exposure give benefits to the agriculture production by increase the production harvest and also increase the production of the harvest. However, according to WHO, there are at least 3 main incidents of the pesticide poisoning worldwide, and about 30,000 people are killed. Even though in Malaysia, we have legislations on pesticide exposure where we try to reduce the pesticide exposure. However, it still happened in Malaysia where in average 3.8 per 100,000 population had incident of pesticide poisoning, and this trend is increasing day by day. Like I mentioned, pesticide exposure can divide into acute and also chronic pesticide exposure. However, for this talk, I will focus on the acute health effect of the pesticide on human health. As you can see, the acute pesticide exposure can be a diverse range of the symptoms, ranging from respiratory, cardiovascular, neurotoxicity, autotoxicity, and etc. And it can be divided into mild, moderate, and severe symptoms. For example, for the mild symptom, it can be as simple as irritation of the nose, throat, loss of appetite, nausea, diarrhea, headache, dizziness. And the moderate, any of mild symptom plus excessive salivation, coughing, sore throat, palpitation, trembling, vomiting, and severe symptom, any of mild or moderate plus inability to breathe or have difficulty in breath, excessive mucus in the airways that cause noisy breathing, increased breathing rate, and finally can cause like unconsciousness or death. There are many studies has been conducted worldwide looking at the acute symptom and also pesticide exposure in developing countries, and Malaysia is one of the developing countries. So we conducted a systematic literature review looking at the exposure to the pesticide and acute health symptom. And based on the this figure shows a Prisma flowchart of the included study. We have like in total 1,186 study after duplicate remove. And then 1,000 study was excluded based on the title. And then we have the study, which further we only include only 16 study because the remaining 36 not relevant study population and also conducted in developed country, because this one I'm looking for developing countries. Okay, all the study were cross-sectional in nature. Out of cross-sectional, 5 have a do comparative cross-sectional study. Majority of the study were conducted in Malaysia, Bangladesh, Thailand, and also few in South America. And then all the study used a self-reported questionnaire to assess the outcome, the health reported symptom. And then in terms of exposure, the majority of the study did not specify the type of pesticide, except 3 studies focused on insecticide and also herbicide. And then out of 16 studies, 9 studies measured the exposure, the pesticide exposure by using a self-reported questionnaire. Is either you have exposed to pesticide or not. And then 3 studies collected data through self-reported questionnaire and also blood CEHS level to determine the pesticide exposure. And then 9 studies used past exposure, where the pesticide exposure from previous spraying event. And then the 7 studies use more recent exposure, where the pesticide exposure from the current spraying event. So what we found out through this system, we found that the prevalence of acute health symptom following the pesticide exposure ranging from 8.8 to 88%. So the range of the prevalence was quite huge. This is because majority not all the studies use the same classification of acute pesticide exposure. And then in terms of health outcome, there are various health outcomes were identified based on the study, including like respiratory symptom, neurology, dermatology, eye, GI symptom, and also gastrointestinal. And the most common symptom were headache, which was reported in 8 studies, followed by skin rashes and also dizziness. In conclusion, based on this systematic review, the prevalence of acute health symptom among pesticide exposed population were diverse, and it's not pathognomonic. It's ranging from respiratory symptom, which is to the neurologic symptom, and from mild to severe. So because of that, we need to interpret the report with caution. So for my studies, there are many objectives, but this is the objective that I would like to share for today's seminar. The first one, to describe the demographic working practices and also pesticide exposure among the farmers in Malaysia. I believe that the demographic practices and also exposure is a difference between Malaysia and also Japan. And I also want to investigate the nature and determinants of acute health symptoms reported by the farmers following the pesticide spraying. So how did we go about it? So this study was conducted among 100 selected smallholder farmers in Malaysia, which is in Kelantan, where I'm originally come from. And then the sampling was conducted between in 2018 to 2019. And then this area were chosen because they are the main agriculture area in the Kelantan state. For the method, for the exposure assessment, we use various methods to assess the exposure. The first one, we use a self-reported exposure. And then we use biomarkers for pesticide and also metabolite. And we use DREAM assessment to assess the dermal exposure by using semi-quantitative approach. And then for outcome, we use a self-reported acute health symptom. And then for data collection instrument, we use questionnaire. We interview the farmers about their demographic, exposure, working practices, and then self-reported symptom and also spraying diaries. In addition to that, we also observe during spraying session in order for us to look at the exposure and also to complete the DREAM checklist. And then the farmers also need to collect the urine sample pre and post spraying season, where we can compare. For the recruitment and participant flow rate, selection of the potential farmers, we got a list of farmers from the Department of Agriculture, and also we direct approach the farmers. And then based on that, we do the first visit where we introduce our research team, and then we tell them about our research project. And so we also provide them with introductory letters, participant information sheet, and also the consent form. And then a week after that, if the participant already have decided whether they want to join the study, and then we went to the participant home, and then we interviewed them to assess their exposure and also to assess their exposure and other demographic characteristics. And then the third visit was conducted during spraying season, where before the farmers spray, the farmers need to collect the pre-spraying urine sample. And then after they do spraying, and then 24 hours after that, we collect the post-spraying sample. And during first day of their spraying event, also we observe, we record a video to complete the DREAM checklist. Then we give the questionnaire to the participant in order to assess the self-reported symptom. We assess the symptom for the next 7 days. And then the fourth visit was conducted at the end of the study, where the participant completed their 7 days diary. So what did we got from this study? We look at the demographic. The mean and duration of the study participant was 47.6 plus minus 15.8. The mean age was 16, and the maximum age was 81. More than half of the study participants had an education more than 11 years, come from low income and also current smoker. And then nearly 100% of the participants were Malay, which is the native race in Malaysia. And then 80.7% were married. In terms of occupational histories and working practices, we divided into rice farmer and vegetable farmers. As you can see that the rice farmers have a bigger farm size compared to vegetable and fruits farmer, where for the rice farmer, the median farm size is about 8 acres compared to vegetable is around 2 acres. And then in terms of spraying session, also we can see that the spraying duration per day and so per week were higher among a rice farmer compared to vegetable and fruit farmers. In terms of application method, as you can see that vegetable farmers, 97% of them use a backpacker spray, compared only 49% among the rice farmer. And then vegetable farmers, they use less power spray, only 3% compared to 21% among rice farmer. In terms of bystander at the field during spray, we can see that rice farm majority, 36.5% of the rice farmer become a bystander compared to 40.9% among the vegetable farmers. And then in terms of incident while using pesticide is more higher among rice farmer compared to vegetable farmer. As you can see from this slide, what I'm trying to say is that rice farmer have like bigger farm and have higher duration of spraying, and then also they have like higher exposure compared to vegetable and fruits farmer. This result, I would like to present the repair and cleaning equipment after spraying. As I mentioned before, majority of them use backpacker spray and power spray. This slide, I would like to share about their repair and also cleaning equipment. As you can see that a majority of the vegetable farmers, they repair their equipment by their own compared to like less than half for the rice farmer. However, in terms of cleaning equipment, the rice farmer like to clean more compared to vegetable farmers. In terms of material use for the cleaning of equipment, what you can see that vegetable farmer, they like to use like water and soap compared to rice and vegetable farm, rice farmer. In terms of pesticide use during the first day of spraying session, majority of the farmers, more than 80% of the farmers, more than 60% of the farmers, they use more than 2 pesticides with already from 2 until 6 pesticides for each individual. And then among the rice farmer, majority of them use insecticide compared to herbicide and also fungicide. In this study, the farmers use more than 40 chemical families and involve 70 active ingredients. This is the commonest pesticide that being used among the participants. First is among the organophosphate group, for example, chlorpyrifos, dimethion, fenthion, glyphosate, malathion, pyrethroid, cypermethrin, deltamethrin, lambda, chelation, and mixture of organophosphate and pyrethroid, carbamate, neonicotinoids, and also others. As you can see that the farmers in Malaysia like to mix the pesticide because they call it a cocktail because they think it more like gives benefit and an effect. And then this is an example of the pesticide bottle in Malaysia. This is chlorpyrifos and also cypermethrin. This is chlorpyrifos pesticide. So I would say it's quite different than what you have in Japan. In terms of exposure, like I mentioned, we assess exposure in various ways. One of the method we use is dermal exposure by using semi-conductive method, and we can see that we can observe the dermal exposure was higher among rice farmer compared to vegetable farmer. However, it's not statistically significant. Then in terms of during mixing or spraying, we can see that the spraying event has a more exposure compared to mixing event. Okay, in terms of urine metabolite, in this study, we measure a few urine metabolites, for example, bifurentine, DBVA, PBA, TCP, and also total DCVA. You can see overall, what you can see that the detectable urine metabolite was higher for all the metabolite pre and post, and then it's remarkably the pre-spraying urine metabolite was higher for PBA, TCP, and total DCVA. It's about 80%, and then it's nearly 100%. It's 100% for TCP. And then we also do analysis in terms of, we look at the difference between post and also pre-spraying among the farmers who apply that pesticide and also did not apply the pesticide. And what we can see is that there was a significant difference between the difference pre and post between farmers who apply and those farmers who did not apply for chlorpyrifos, cypermethrin, and also pyrethroid. So what we can say that what we hypothesize that the farmers who apply pesticide will get like higher, the difference between pre and post was higher and is the same with what we hypothesized. And then now we move at the outcome where we're looking at the symptom occurring within 48 hours of spraying. One of the 3 participants reported at least one symptom following the pesticide exposure. And then we can see the symptoms were more common among the rice farmer compared to vegetable farmer, and it shows a statistically significant. And then this figure shows the variation of the symptom over 7 days period. The symptom more common during day 1 and then gradually reduced over the week. And then we further classify the symptom because we have like more than 50 symptoms. We classify the symptom based on pyrexia and respiratory. Based on the previous study, they did a factor analysis. The pyrexia consists of symptoms such as generally ill, unusually tired, shivering, hot or cold, or headache. And then 5 symptoms for respiratory, for example, runny nose, a blocked nose, cough, shortness of breath, and also wheezing or eye irritation. And then you can see that the pyrexia symptom more common than a respiratory symptom. Is about 18% of the participant experience pyrexia symptom compared to respiratory symptom. And then based on this, we do a logistic regression, and it shows that the participant who wore the face shield have like 3-fold higher risk of having pyrexia symptom. And then the participant who wore like chemical resistant would have a lower risk to get pyrexia symptom. I think this is my final slide. As for conclusion, we can see that the pesticide exposure was observed among the study participants, and then the reporting health symptoms also were observed and associated with pesticide use. However, the symptom is not maybe because of other factors as well, because of the weather in Malaysia is hot and also humid. And also, however, the result of the finding can serve a foundation. At least we have the baseline data about the pesticide exposure and also ill health effect in Malaysia. I think with that, thank you very much. And this is my email address. So I'm looking forward to see you in Malaysia or anywhere in the world. With that, thank you very much. If you have any question, if I can answer it, I will answer it. Thank you very much.